Thank you for watching Weekend Prime and welcome back. For decades, the main treatment options for fibroids, non-cancerous tumors that grow spontaneously inside the wall of the uterus, has been traditional invasive hysterectomies. Now, however, new technologies is providing more treatment options that are promising less pain, faster recovery, and even the potential to preserve fertility. On this episode of Health Digest, Gloria Milimu explores one such treatment method that uses ultrasound energy to heat and destroy abnormal tissues like fibroids and the treatment of adenomyosis. Take a look.
Ordinarily, treatment procedure for patients like 31-year-old Naomi, not her real name, would involve a whole list of theatre preparation for an invasive procedure to remove non-cancerous growths that invade the uterus wall, causing patients like her to experience heavy menstrual bleeding and pain that can be debilitating and also impact on fertility. However, technology is now making it possible for patients like her to undergo treatment for non-cancerous tumors like fibroids without having to come to contact with the doctor's knife, promising less pain, faster recovery, and even the ability to have children after successful treatment.
I was diagnosed last year. At first, they were very tiny, and I just continued to stay with them. But the more I lived, the more they became very painful. So towards the beginning of this year, when I came, I found they've multiplied. There were many.
This is a multiple fibroids.
Like any other procedure, her treatment began with a series of tests to determine whether she'd be suitable for the high-intensity focused ultrasound procedure that will be used to treat the fibroids.
We need MRI to make sure it is fibroid, multiple fibroids, and meiosis, or any other types. We need to make sure the ultrasound energy will accumulate inside of the fibroid in order to kill it.
The treatment that is just being introduced in the country, according to experts, leverages the use of ultrasound waves to hit and destroy targeted tissue without harming the nearby area. The outpatient service involves the patient lying on a table with an opening underneath it, known as an aperture, that exposes the patient's tummy area, that allows the ultrasound transducer to be positioned directly underneath the patient. Light sedation is administered for pain control before the procedure begins.
So the intensity is much higher than normal scanning ultrasound, and also it will be focused into one point. The transducer can output the energy inside of one point, and the focus point inside of human tissue, the temperature will reach up to 65 to 100 degrees. It varies from different tissue. For example, if it is only a 5 centimeter single fibroid, we usually treat just need about 1 hour. But if it is a lot of fibroids, no matter it is small or big, it will take longer time because we need to find each fibroid and treat each fibroid.
Fibroid treatment in the past involved doctors making cuts on the patient in order to remove the tumors or even the whole uterus.
You see when the transducer output.
However, given the non-invasive nature of the treatment that now uses high-energy waves to target the fibroids, experts say it allows for the preservation of the uterus, therefore improving treatment outcome for patients like Naomi. Doctors say options to treat fibroids vary depending on the size of the tumor, their location, and even the severity of symptoms. They can be as small as a grape or even bigger. The condition affects a significant number of women worldwide, with those of African descent being more predisposed to the uterine tumors.
I've always had painful periods, very painful, but I started taking painkillers and it was okay. I'll take painkillers and I'll go past it. But it became serious when I no painkiller was working. The doctors were prescribing higher and higher doses. but they weren't working.
Benign uterine disease such as fibroid and adenomyosis, it's a common gynecological disease, okay, and occurs about 20 to 30% worldwide. However, in the African population, the scientific evidence is there that the incidence of these two diseases occurs 3 to 4 times higher than the other ethnic groups. So therefore, African women has 80% of the chance in the childbearing age to develop these two conditions.
Fibroids are a significant source of health burden that doctors say can significantly impact on the quality of life of a patient, and therefore providing them more treatment options will go a long way in handing them the power to take charge of their health and future.
We as experts can advise, can suggest that this is one of the things that we think, one of the methods that we think should be available in line with the Constitution, because then it gives the women the right of choice of the method of treatment and the highest quality of care.
Fibroid and adenomyosis are common gynecological disease, okay? So to protect the fertility, we need early diagnosis and screening. So therefore, we encourage women to go to annual checkups. Just with a simple abdominal ultrasound, actually you can identify fibroids.
For patients like Naomi who will come back for review after 1 month of the procedure, the scarless and minimal to painless procedure does not only offer hope for better treatment outcome, but also choice of mode of treatment for the debilitating condition. Gloria Milimu, KTN.